Welcome to Bite the Talk, a podcast hosted by the Global Alliance for Improved Nutrition, known as GAIN. Join us as we discuss all things food systems related: diets, nutrition, environment, health, you name it. Meet fascinating people working in the nutrition and food community. Tune in to Bite the Talk and let's explore together.
Hello everyone and welcome back to Bite the Talk, the podcast where we explore the stories, systems, ideas and innovations shaping the future of nutrition and food systems. I'm your host, Mark Gachagua. Today's episode is a special deep dive into something bold and forward-looking: the Nutrition Futures Initiative. It's an effort designed to strengthen the nutrition impact of social protection systems through a powerful approach known as co-innovation. Why does it matter? Because today, across Africa and around the world, millions of people rely on social protection programs, cash transfers, public works, food support, school meals, but these systems often don't fully meet people's nutritional needs. Nutrition Futures Initiative aims to change that. To help us unpack all this, I'm joined by three incredible guests. First, we have Dr. Anthony Wenndt, GAIN's lead on social protection. Now, Anthony has been instrumental in building the conceptual and methodological foundation of the Nutrition Futures Initiative, working side by side with governments, development partners, and innovators. Welcome, Anthony.
Thank you very much, Mark. It's a pleasure to be here.
Next, joining us is Thomas Schuumanns, co-founder of Proportion Global, GAIN's co-partner in developing the co-innovation approach and co-founder of the Innovators Team platform, a global community of social innovators working on real-world problems in food, nutrition, and social protection. Thomas, it's great to have you on the show.
Thank you very much, Mark. It's great to be here. Thank you.
And finally, we are honored to have Commissioner Patric Mugisha from the Uganda Ministry of Trade, Industry and Cooperatives joining us. They've been deeply involved in improving policies to strengthen food systems and working to integrate nutrition more meaningfully into public programs. Thank you for being with us.
Thank you so much, Mark. Pleasure to be here. Asante sana.
Karibu sana. And for Anthony and Thomas, Karibu means welcome. We're going to learn. And Commissioner, you know, the biggest news out of Uganda right now is that you guys had an election. How is it so far?
No, everything is well contained. And these are no more systemic issues that span across the continent. But good democracy, we believe there's everything for everyone.
Yeah, I agree with you, and we are wishing you all the best with that. And then on this podcast, before we start and dive deep into conversation, I'm curious to know, and I usually ask the guests, what was your favorite childhood snack? Since we are still on you, part, what was your favorite childhood snack?
My favorite childhood snack?
Yeah, what did you like eating when you were about 10 years old?
Very well. Now, apparently, of course, this may take me a little bit. I'm half Kenyan, half Ugandan, and so I grew up in Kenya. I left Uganda when I was 4 years. So my large part of my life, childhood, early childhood, teenagehood, primary school, O-level, I was in Kenya. So basically, I would imagine I should actually talk about what I was really fond of eating while I was in Kenya. I don't know, for some reason, the conflicts of our times, just really was so good. I don't know.
Conflicts?
Conflicts, yeah. Really, today it tastes a little bit different. I don't know, but maybe we were just in different eras, but I really love it. And of course, I recall during our time, that was when the late president was in charge, His Excellency Daniel Arap Moi. So they used to give us milk in schools, maziwa ya Nyayo. So it was really good memories.
Oh, that's really nice, Commissioner. That's really, really nice. You really sounds like you enjoyed your childhood. What about you, Thomas? How was it for you? What was your favorite snack?
Yeah, well, I just need to think back to the time I was 10 years old. And the first thing that comes to my mind was not food, actually. It was the joy to live in the rural parts of the Netherlands. So currently I live in Amsterdam, like a big city, but I grew up in the rural parts of the Netherlands in the south. And we lived really near the woods and in maize fields. So my brother and I used to play a lot outdoors. We climbed trees. We were swimming in a lake. We would run through the maize fields. And when we come back home, my mother would have cooked those thin pancakes. And we like sour and sweet at the same time. So we had them topped with cheese as well as, how do you call it, syrup. And that just really is delicious. But after being outdoors with my brother, those are sweet memories.
Very nice. I'm actually envious, Tom. I'm actually envious. I mean, running through the maize fields and climbing trees, swimming in the lake, and then coming home to a very nice meal made by your parents. I mean, that's a slice of heaven, right?
It is. It is.
Well, what about you, Anthony? What did you enjoy?
This is a wonderful question, and I think my favorite childhood snack really wonderfully blends the themes of corn and rural that Thomas and Commissioner Patric have also mentioned. I grew up also on a farm in a very rural part of the U.S. In a state known for corn production, for maize, and there's nothing more nostalgic from my childhood than a hot summer day with sweet corn, butter, and salt. That's a delicacy in my hometown, and many cherished memories around sweet corn on the cob.
Anthony, you're going to make our audience, salivate and be really, go look for that sweet corn, But, the interesting bit about this question is it's all connected to corn, and we never learned about this, we never even discussed this before, because my favorite childhood snack is actually roasted maize on coal, and then you take some chili and then rub it on the maize using lemon, so it's very zesty and chili. So that really used to make me happy, especially on my way home from school. That was my favorite snack. I think we all have very nice favorites. So that's really nice. I think it's time for us now to dive deep into the conversation that we have. We are talking about social protection. We're also talking about nutrition. And we can start by grounding the listeners, sort of give them a good background and for us to have a shared understanding. Social protection systems are powerful. They reach millions of people, but they don't automatically improve nutrition outcomes. Why is that the case, Anton?
That is a big question, and there are many moving parts that form the answer to that question. But at the end of the day, nearly all social protection systems have the potential to impact nutrition and to support governments and communities to achieve their nutritional goals. The challenge, though, is ensuring that the benefits and the systems are designed in ways that are responsive and sensitive to local people's nutritional needs, and crucially, the access constraints that limit their access to nutritious foods. I think these are some of the key challenges that social protection systems and system administrators face when they attempt to design policies and programs that can really be transformative for nutrition. So yeah, there's a lot that design has to do with it. And that's part of why we've been so keen to support governments and system actors to implement better designs in their programs.
Fantastic. And that's a very rich response. And that kind of brings me into, wanting to know more about how governments are doing this and also the element of co-innovation. But before we get there, Commissioner Mugisha, where do you see the gaps when we talk about social protection and nutrition?
No, I think maybe if I could speak from the point of a policymaker, I think it begins everything. If you want really something good for your citizen, if you want a good future that is sustainable, then I think the policy landscape also has to be definitely inclusive. And that means that it has really to meet the actual needs, dynamic needs that will always evolve depending on the changes. Talk of climate, political landscape, and also the economic landscape that can also impact all this. But of course, from a policy, it's just have to take a very sensitive approach. And quite often as a country, Uganda in particular, let me use that as a case study because that's where I'm domiciled at the moment. But some of these key issues are quite systemic when you talk about within the sub-Saharan Africa. and especially within the LMICs, the low middle income countries. So to me, I believe it just takes the policy aspect. Where a policy is pro people, then I think it can always be aligned to meet the dynamic needs of the people. But of course, easier said than done. Because at the end of the day, you find out the key actors just really need to be aligned. And of course, usually it's a question of misalignment, looking at the government, the funder, the government partners, the community itself, and I think policymakers. So I really feel when there's a disconnect between those key actors, I think things will definitely never achieve the kind of real impact that we really want to see. That's from my end.
Thank you, Commissioner, and that really sets the stage for this conversation. Now, let's define this concept that I mentioned earlier, co-innovation. Dr. Anthony, what exactly does it mean in the context of Nutrition Futures Initiative? Co-innovation, what does it really mean? Please unpack it for us.
Thank you, Mark. Co-innovation is really the concept and the mindset that is at the core of the Nutrition Futures Initiative. And I think the definition is very nicely reflected in our tagline, innovating together. We really believe that the best and brightest innovations and the cleverest solutions to some of the big challenges that exist in the world come from processes that bring various stakeholders together and allow us to leverage diverse and even unconventional viewpoints in the design and delivery of these kinds of solutions. So co-innovation is just that, innovating together. And the Nutrition Futures Initiative really does aspire to create a platform and a space to allow these diverse stakeholders, all the way from senior government officials down the line to farmers and community members, to aggregate their viewpoints, come together and be a part of creating the innovative solutions of the future, the Nutrition Futures Initiative, in fact.
Yeah, thank you, Dr. Anthony. And I like that, innovating together. Thomas, you're an expert in this area. You have some expertise in innovation. What makes co-innovation different from traditional program design? What should we be looking out for when we are talking about co-innovation?
Thank you, Mark. I think there are many differences maybe between how you normally design or traditionally design a new program versus using co-innovation as an approach. So as my organization is experienced in applying human-centered design with a lot of local human-centered design professionals, we guide our clients and partners in that process. And let me just give a very concrete example, also to complement Anthony and Commissioner Patric, is when you design a new program, especially when it comes from a policy point of view or from a donor point of view, a lot of scoping is often already given. It's said like, okay, especially money talks, this is what is expected to be done. Or when someone is developing a program with maybe 10, 20 years of experience, people have a lot of dominant logic, and we should cherish that logic and that dominant experience. But it's also a barrier. It's a barrier to really look at a challenge with a fresh, open mindset. So one of the first steps of co-innovation is actually putting your expert mindset aside for a moment and really look at the challenge with open eyes. So that means that if you want to target, for instance, the ultra poor in a certain region, make the time to really dive into that community, even when it's very comfortable to stay at the office, right? And stay behind your laptop and write your proposals. Take the time to meet the people you are designing for. And by truly putting yourselves in the shoes of the people you are designing for, you get to learn their stories, their insights. And I think that's a crucial starting point for designing a valuable program. So this is just one element that I'd like to highlight, but let me pause there.
And that's, Thomas, that's a very nice way of describing it and explaining to us, living with the people and kind of understanding and getting at least a glimpse of the lived experience of the people that we want to serve or you want to serve. So that's really, really nice. Commissioner Mugisha, from a government's point, what changed when you adopted this co-innovation mindset?
Yeah, so maybe just allow me to give you another small background. So before I joined the Ministry of Trade, Industry and Cooperatives, I've actually been there for 1 year now. And previously, I was working with the Ministry of Science, Technology and Innovation, of course, which was abolished in 2021. And I was the Commissioner for Innovations and Intellectual Property Management. So my technical background, I'm a synthetic organic chemist, but also I'm an intellectual property law trained practitioner. So innovation has been part of my journey throughout my career at the earliest possible. And whenever I talk about co-innovation, it just brings this platform to just tell you that Mark, my colleagues Anthony and Thomas, if you look at each other right now, you realize all of us are byproducts of our co-innovation. Do you believe that? I think you do. If by any chance you interact with the Bible, which is a person who pursues as a Christian, one of the most intriguing verses in the Bible is Genesis 1:26, which says that let us make man in our own image. It doesn't say, let me make man in my own image. It means to get Anthony, to get Thomas, to get Mark, Patric, these guys had to sit and say, no, what if maybe God the Father said, maybe let's just give these guys one eye. Then the other part said, no, I think they need two eyes. Co-ideation partnership started at the earliest, at the time of creation. So it just shows you that when you co-ideate, indeed the way Anthony has brought out that you first put your experience aside and you let reality check in. So that's why you find at the end of the day, from the government perspective, one of the most challenging things we normally face on a day-to-day basis is to have interventions that can be easily scaled through the public sector route. The moment they misalign to the policy priority, they will never see the light of day. They'll be dead on arrival. This is why I think whatever we're talking about here is going to be quite instrumental to trigger the whole aspect of nutrition in a much more sustainable manner. Thank you.
Thank you, Commissioner. And there's a reason why you're the Commissioner here and I am not. That example that you've given, that explanation, I think it's fit for Commissioner. And I think that's really, really nice. It really opens up, the box and it allows us to have that good understanding. Still sticking with you, Commissioner, what does it take for a government to fully embrace co-innovation?
It's very easy. But I can guarantee you, one of the most, Anthony and maybe Thomas may bear witness to this. This whole bit of innovation, at times we do kind of like crucify policymakers. But the truth is, this is the level of awareness. They may not understand this subject matter because an innovator is going to come that I've got an innovation. And for you think that, of course, it's very common where an innovator is actually going to be emotionally attached to his solution. He or she knows that this is the best solution ever. But then the question is, emotion aside, you could find whatever you're presenting actually cannot be scaled. And you realize that if at all you're going to innovate void of where priorities are of government, then it becomes something totally different because that journey to scale, when you want to center government as one of the co-ideators that you need to get on board, if that chain is broken, it's very hard to achieve that goal. But what you're trying to do, coming from the perspective, for example, of course, if let's say, for example, a government has got, let's say, a science, technology, innovation ecosystem or national innovation system, it means that they do recognize the importance of innovation across board. And that's why innovation is cross-cutting across multiple sectors. So when you talk of innovation in the agri-space, may not be the same as how innovation will be interpreted within the mineral and energy space. It may not be the same in the education space. So I think it's a question of now demystifying and narrowing down to appreciate from the policy perspective, what does innovation mean for this as a sector? So I think that's where we really want to navigate around, but you cannot take innovation as a blanket picture because you lose it. So let us go down to reality and know that in the case of food and nutrition, what should be the strategic role of government? And if when you prioritize it, then that means we've got a chance and you bring every stakeholder on board. So I think that's what really on my end I would say as a policymaker. But of course, a lot of advocacy, create a lot of awareness among policymakers for them to appreciate what exactly is this all about. And maybe lastly, if I may, also co-innovation, it can also, there are two aspects. If we go by one of the famous scholar, economist, Professor Henry Chesbrough, who brought this whole context of open innovation and closed innovation models. So ideally, you realize the moment you talk about co-innovation, you're actually switching towards open innovation because now that means that you believe that I need external ideas to inform internal ideas. So that would mean no one is in a closed box. So that's basically how these things really run out. So ideally, we'll be looking at appreciating and advocating for open innovation, because we believe even the views of the community matter. The views of the policymaker matter. The views of the funder, the partner, strategic partner, implementer, and industry do matter. I'll stop there.
Thank you, Commissioner, and that's a very nice explanation. Now, Thomas, challenging dominant logic is not the easiest thing. When you think about it, it's really, really nice, sounds very good, but I'm persuaded that it's not the easiest thing. What advice would you give to governments who are curious but a bit hesitant to adopt co-innovation as a concept?
Okay, let me see what causes hesitance. So I think it's about certain barriers to change how we normally work, right? So I think if we unpack the different barriers that organizations have, whether it's a government or a large corporate, I think there are a few, and I think we can easily also counter that. One of the first barriers could be like, okay, we know what to do, right? We've done this for years, new program, let's sit together with a couple of experts and we know what to do. So my response to that would be to take away that barrier of innovation. I would say there is no risk in just listening to people with a new open mindset. It costs maybe a bit of time, and it costs the effort, and maybe it feels uncomfortable to go out of the meeting room. But what is really the risk? Just to speak to people and listen. And I think listening intensely and with indeed deep intentions is key. I mean, I think a lot of people, and I love what Commissioner Patric said about also innovators who come in with their innovative idea and are emotionally attached to it. I think too many people come to the co-innovation room to pitch an idea and they skip listening. And it's really about understanding people's perspectives, also understanding people's interest and strength, and not just listen in order to pick that moment to start talking, because often people listen to create space to talk. Then the second element, I think, what could be a constraint for big organizations are the time and budget constraints. People like to dive into creating solutions directly. But again, I would say spend time to really unpack the problem. I think it was a quote from Einstein who said, if I have a problem to solve, I spend 80% of the time to really dig deeper to understand the problem, and then the last 20% of the time I would spend on solving it. And I think that's an interesting one. So it's especially innovation sounds really sexy. It's easy and really encouraging to directly jump into crazy ideas, but spending some time to really understand the challenge from a user perspective can solve also in the end a lot of time. So if you jump too quickly to solutions, you might spend time and money on a solution that eventually is not solving the real problem. And then a third level could be maybe the lack of confidence and lack of skills. People might not know how to deal with co-innovation. They might have never done it, which is understandable that people have maybe a bit of fear to dive into it. And I think this is where training and also facilitating the design process comes in. This is also where the nutrition initiative comes in, or Future Initiative, and also Proportion Global as an institution. We coach and we guide people in that journey, giving them confidence on the job.
Thank you, Thomas. I think that's a key thing you've mentioned, confidence and coaching them to kind of give them that knowledge and for them to understand these are the benefits that we could potentially have if we co-innovate. I like that. Dr. Anthony, obviously you lead Gain's work on social protection. And just to be curious, from Gain's perspective, what unlocks success in this area of co-innovation?
Yeah, I think from my perspective, success is a factor of our ability to listen to the system. Echoing what Thomas just said, we at Gain in our social protection work really adhere to a human-centered design philosophy, and in all the support that we give to our government partners and in all the support we give to actors across the value chain, we really want to create an enabling environment, not just to hear what different stakeholders have to say, but to constructively listen to those viewpoints and internalize the insight that we receive. Really, I think there is oftentimes a gap in our understanding of the root causes of core challenges. And it's only through constructive listening that we can really even hope to get a clear picture of that process. One thing that I think is so central to our co-innovation philosophy is imagining a sort of paradigm shift in the way social protection systems receive feedback from users, from beneficiaries of those systems. I think classically, the feedback from users is channeled through grievance redressal mechanisms, which automatically positions good input, good feedback as complaints, as negative, as judgment. And so part of what we are trying to do through the Nutrition Futures Initiative, and indeed in all of the human-centered design work we do in our social protection program, is try and create a safe space where governments and other system actors can engage with users not just as subjects, but as equal co-partners in building better solutions. And I think one thing that we are really aspiring to do is to move away from the idea of one-way grievance redressal mechanisms and toward more cyclical or iterative feedback loops that connect these social protection systems with the lived realities and key challenges faced by the beneficiaries and the end users at the receiving end of that system. So that's my initial thought.
Yeah, thank you. And just sticking to what you've started unpacking, I'd like us to, now lean more towards Nutrition Futures Initiative. We have a diverse audience, Anthony, and it would be nice for us to kind of unpack a Nutrition Futures Initiative. What is it in simple terms?
Yeah, the Nutrition Futures Initiative is a platform and a movement, and indeed a community of diverse actors from across the global south that have a shared interest in improving the nutrition impacts of a range of social protection systems, services, and benefits. This is a platform that emerged out of the need to think beyond the status quo and to move beyond the conventional approaches to nutrition in social protection systems. We observed that over and over again, policymakers and system administrators, in a way, were leaning on the same set of tried and true nutrition solutions. And the reality is that the nutrition impacts of social protection systems have not kept pace with the growing needs among the targeted populations. So this platform is really a space and a community for aggregating all of these diverse viewpoints and creating that safe space or a playground for really imagining the next best solutions for nutrition impact and social protection across the global south. And crucially, this is not just an idea or a vague service offering. This is a real platform that, together with Thomas and Proportion Global, GAIN has built with the specific purpose of engaging these different stakeholders in processes of co-innovation. And indeed, the Nutrition Futures Initiative, as a project of GAIN, lives within that broader digital platform environment called the Innovators Team, which is an exciting resource that can fuel co-innovation and this sort of collective action for innovation in food systems at GAIN and far beyond as well.
Yeah, and then Thomas, this is where, as Anthony said, this is where your innovators team, the platform, this is where you come in. Tell us more about that and how was the journey?
Yeah, thank you. So the Nutrition Futures Initiative, NFI, they needed also to have an online infrastructure, right, to bring people together. And that's the Innovators Team platform. So that's the ICT infrastructure. So Proportion Global and GAIN jointly developed this ICT infrastructure, and it's the go-to place if you want to solve challenges worth solving. For NFI, the platform is a place to unite the people who are focused on social protection, but also, like Commissioner Patric mentioned, systemic innovation is also required in the healthcare sector, in the education sector, etc. So the Innovators Team platform is the infrastructure that can host those different ecosystems. But our key focus for now is to host the NFI initiative there. And basically, it's an online space, a space where people can create their own user account, their own user profile, can join the innovation groups. So the NFI has a group on that platform. And once you are logged in, when you are in that space, there is also a guided experience that guides the participants to solve a challenge, right? So it starts with the scoping, understanding and sharing. Okay, what is the scope of the challenge? How do we then eventually dig deeper in research? How do we create ideas? So that human-centered design process is a guided process on that ICT platform.
Thank you, Thomas. And Commissioner Patric Mugisha, how is Nutrition Features Initiative showing up in Uganda, in your country? Perhaps you can also tell us the plans that you have.
Yeah. So basically, by default, I think we are actually living this dream, I should say. And not until looking at GAIN as an entity has been operating in Uganda since 2007. So you can imagine that's close to nearly 20 years now. GAIN has been in Uganda and they've done a lot. But if you look at their focus areas is always to look at how do we improve the nutritional landscape by ensuring safe foods and nutritious foods actually being consumed across the population. And so one of the key things where technically we want to twitch a little bit the NFI initiative and with support of Anthony and Thomas is right now we are trying to review our policies. That is the MSMEs policy of 2015, there's a micro, small and medium enterprise policy of 2015 and the national standards and quality policy of 2012. And so traditionally this follows a very physical, rigid process. And one, we are living in a global economy where whatever happens in Uganda could potentially affect the value chain even in the EU, where actually you're not there. Just one act of maybe negligence or maybe assuming that this won't bite the system, and eventually it does. So to us, want to look at anyone that, because since no one is an island, and we believe that when people come together and they share ideas, even in the policy review and development process, it's critical. So you can imagine how robust and versatile that NFI strategy or tool can actually be, because it follows a systematic approach, which you can actually say, get views from people, let people speak, let them be free to actually say what they think. Because if I asked from the MSMEs in the nutritional space, what should the next MSME policy of the country look like in your perspective? These guys, they need to be given a platform. They need to say that maybe we need ABCD. Like, for example, you would imagine one of the key support mechanisms that GAIN has always advocated for in this country has been the issue of industrial fortification. So, but you realize that there's a challenge where you find like maybe, yes, if that, for example, fortification is more of like the current legal landscape says that when you're producing flour, let's say maize flour, or that has to be fortified. If you're producing a tonnage of less than 20 tons per day, like you don't need to fortify. But if you look at the most millers within the ecosystem here, produce like 1 ton, 5 tons. So clearly at the end of the day, you'll find that maybe malnutrition or maybe that deficiency of the micronutrients that we need, it may not reach the actual consumer because the current legal framework kind of like exempts those who produce in smaller units from fortifying their maize. Yeah, those are the biggest sellers in the informal space. So I think those are the things that we really feel that with this NFI initiative, that's when I want really to borrow a leaf. Look at it. How do we turn it around to be a useful tool that we can actually adopt moving forward and to really bring this into check? But to me, I believe once this picks up, it's something that can actually be adopted across multiple policy sectors, but it's definitely a meeting of minds. And that's why I believe things can actually change effectively. Yeah. Thank you.
Thank you, Commissioner. Thank you very much for that. It's very clear. And Dr. Anthony, have you begun to see early signs that co-innovation is making a difference?
Absolutely. Through our work, even now in the early stages of operationalizing this platform and in defining the role and the scope of the Nutrition Futures initiative, there have absolutely been promising signals that this approach is welcomed and needed across a range of topics and a range of innovation opportunities in the global south. One big signal that gives me a lot of confidence is that through the platform, we recently recruited our first cohort of co-innovation host partners, those actors in organizations and governments across the global south that have sticky problems, big challenges that they wish to solve. We've recruited our first cohort of host partners for this year, and they have been so receptive to the model and the mission that NFI offers, this co-innovation approach, and even seeing how this thinking fits within their ways of doing things, of their processes of policy change and programmatic development has been really reassuring. It gives me faith that this is responding to a real need and that NFI and indeed the Innovators Team platform as a whole is flexible and adaptable enough to respond to a range of needs and innovation challenges across the global south.
Thank you for that. We've touched on scaling up, Thomas. We've alluded to that, but we want to understand, what makes innovation scalable in social protection?
That's an interesting question. What makes innovation scalable? I asked that same question to a lot of innovation directors of large INGOs. I organized a couple of roundtable sessions. I actually co-created the answer to this question with a couple of innovation directors. And what came out was a very instrumental tool. I think everyone knows the Bismoller canvas. Well, we have developed a certain canvas for scaling innovations. It's called a scaling innovation canvas. And it particularly has 3 pillars. Let me briefly explain the 3 pillars. Pillar 1 is the innovation itself. And I think the process that we have now on the Innovators Team platform guides people to really co-create an innovation that works, which is based on insights from the community, insights from the different ecosystem players. And there needs to be a proof of concept that the innovation is actually desired, but also feasible and viable at a small scale. The second pillar is really about having a clear long-term future in mind. If you don't have a long-term future with a mission and a big idea and how to get there, you will never scale. So you need to jump to the future and articulate that, and also articulate simple indicators on how to get there and how to make a roadmap. So that's the second pillar. Then the last pillar is getting your resources in place. So this is human resources. It can be your own human resources in your organization, but also those of the ecosystem players. Secondly, you need to have your financial resources in place, and thirdly, your intellectual resources. So if you have a innovation with a future forecast and your resources in place, then you're really set up for good scaling.
Yeah, and thank you, Thomas. And lately, we've been having this discussion about resources, especially among international non-governmental organizations or even development partners. But that's not going to stop us. We really know. But Anthony, how does GAIN, innovation scaling through nutrition? How does that look like?
So obviously, social protection by its very nature is an incredibly scalable sort of system or intervention. Social protection is usually blanket that touches hundreds of thousands or even millions of vulnerable households in a particular country. But that's not to say it's easy to take an innovative idea to scale in that context. So something that at the Nutrition Futures Initiative, we are really committed to doing is helping our co-innovation partners identify that pathway, that longer term vision that Thomas was just alluding to. And the co-innovation journey that is part of the Nutrition Futures Initiative experience is designed to give those partners a step-by-step pathway in which they will identify the needs and crucially identify the actions that they need to take in order to achieve their goals and take the innovations to scale. Just to give one example, the final phase of the Nutrition Futures Initiative co-innovation journey is revolving around an action plan, thinking about how those partners, as they've assembled, as they've co-created an innovation, can position themselves and their expertise and the resources at their disposal in such a way that they can take their innovative idea to the next level. Crucial in this part of the process is acknowledging the state of maturity or readiness of an idea to achieve scale. There's, I think, a natural desire to think that this good idea can be instantly scaled to massive proportions. But in reality, policymakers and systems need to achieve a level of confidence and readiness in an idea before it can achieve scale. And so part of what we're doing at NFI is thinking about how to embed in that action plan the necessary confidence building steps like generating robust evidence, implementing effective pilots or tests that can help the administrators who hold the power to scale solutions be confident and assured that that solution is an adequate answer to the problems that they're facing.
Right. Fantastic. And, Commissioner, you told us about the policies that are currently under review or will be in review. But what does scaling look like in the national context from your perspective?
Yeah, of course. One of the key things that, as I said earlier on, I tried to touch on it a little bit, is that public sector scaling is quite one of the fundamental avenues that social protection can actually achieve as far as nutrition is concerned. Because when we talk of public sector scaling, we're definitely looking at if a solution has been tested and proven, then it should actually automatically be integrated into the existing maybe frameworks of government. I'll give you an example. If let's say, for example, we have thought of maybe that if supposing Uganda, for example, says that now we are having a challenge with maybe malnutrition among maybe the under fives, for example, and as an entity you develop let's say a nutritious maybe energy pack or maybe like a bar, nutritious bar, and you realize that actually this one, maybe the under fives or maybe the school going children can actually pack it as a snack, just really to try to navigate around it. And of course, you're looking at maybe developing this from locally sourced materials, because at times you realize today you might want to bring in like introduce foods that are not really kind of like natural to a particular locality, and it becomes very hard to have a buy-in into it. So you have now to rethink the process, and you say, if the location loves eating, for example, groundnuts, for example, or peanuts, and you try maybe to substitute with something else, it may not go fine. So you try to kind of like let us produce a solution that speaks to both the ethical, cultural practices aligned in that regard. So scaling becomes much easier, because even when as a policymaker you try to advocate for it and it is captured maybe in the national program. For example, now we've got a Uganda National Nutritional Action Plan 2 now, which is running, and of course, but I think it's up for review also. But you realize you have to strategize from the top to bottom, and that's why even in our constitution, and a right to access safe food and nutritious food, it's in the constitution. So really, when you actually go against that, it's an offense. Yeah, it's an offense. So to me, I believe scaling will go back to where you're having a multi-sector approach. We're going to operate from maybe a quadruple helix kind of innovation model. We've got the state, we've got the private sector, we've got academia coming on board, we've got the community itself being engaged heavily onto this. And eventually, I think that is actually what is actually going to matter in the long run. So scaling, I must admit, Mark and colleagues, scaling is not easy, especially in the context of social protection, because Uganda hosts about 2 million refugees as of today, statistically, about 2 million. And you can imagine now the bit of, I can guarantee that ensuring that whatever these guys eat in the refugee camps or maybe the host communities, the level of safety, the level of nutritious, the foods they're eating, sometimes it's questionable, because really at times it's still this mindset, but this maybe could be just some of the vulnerable communities around or people, persons. So to me, I believe scaling, it just goes beyond. I think it also taps into a mindset change, really, for every actor that is actually going to come on board, because quite often you also realize that just that misalignment of one partner saying that I cannot work with another partner, because even development partners have got their own clashes. Yeah, Someone says, I'm coming from this country, I cannot work with a partner from this country. Now, you've come to Uganda. Once you are one government, but you say, and that's how you find this duplication of efforts. You're going in the same space, all of you are there, resources cannot actually be streamlined to touch into different aspects, but everyone wants to do the same thing. So I think that dialogue, that's kind of like a mindset change, the flexibility among development partners and policymakers just to get on the round table and discuss what real issues is still at the center of a scalability of a solution, seeing the light of day or not. Yeah.
Fantastic, Commissioner. Fantastic. You just reminded me that unity is strength. So when the development partners and the government and any other person who is involved in development, when they come together, surely there will be some very nice results to be seen. Let's shift gears a bit as we wrap up. And we're going to, I'm keen to ask you something a little bit more personal. This is not about co-innovation or about, all these things that we've been talking about. But Thomas, if I can start with you, what is that one thing that you've learned from communities that shapes the way you approach co-innovation? Because evidently you have a very wonderful way of approaching this thing. Perhaps there's something that you learned. Tell us more about that.
Something to share about criticism that I've received back in the days, and I talk about more than 12 years now. Personally, I used to do some research myself before we changed our model. Now we operate with 250 designers across 65 countries in the world. So a lot of our work is now being done by local designers. But back in the days, I did a lot of research myself. And when I deep dived into communities, first of all, as a Mzungu, you get biased answers, right? If you do research. But there was quite some criticism as well, saying some community member told me, like, you guys come in with research questions. You spend hours with us extracting data, extracting information from us. And what about feedback? When do we hear something, what came out of that research? So it really struck me, like, we should stop just engaging with communities at those moments that it suits us. So if we need data, we go into the field, we collect data, and we say, thank you, bye-bye. And it really struck me how we need to approach co-innovation, because we need to build partnerships long-term with communities. Today, we might want to engage with them about social protection. We want to learn from them. We hear their stories. But then the next step would be, okay, we have synthesized all these stories. We've come up with key design challenges. Give that back to the communities. These are the design challenges that we think we need to solve. Is this indeed correct? So validate it. The next step is we need to come up with ideas how to solve these challenges. So invite them to the room to be participating in a design sprint to come up with ideas. Once we select the most promising ideas and turn them into prototype, engage them in creating a prototype, validate it with the community in the prototype. So my story is engage them not only in the research phase, but throughout the whole journey. And also not just about, in this case, in this example, about social protection. These communities can also be really instrumental to think about menstrual hygiene management, to think about how can we solve education challenges, how can we solve healthcare challenges. So my dream with the Innovators team is that we are not just an ICT platform, but we are a space for those who really want to innovate and change life at community level to be welcome there. Even once a certain innovation project has ended, being present on that infrastructure will not end. We will launch new challenges. We invite people to keep on engaging, and it's also a way to make it simpler to provide feedback loops. Constantly plowing back what we have learned back to the communities to validate. So having a long-term partnership.
Fantastic. I feel like that's a mini masterclass right there that you shared with us about your approach. Anthony, what motivates you to keep pushing on this work on social protection? What really motivates you, if you don't mind me asking?
Yeah, what motivates me most of all is that there is this unending quest to give space and create a platform for people in their communities in the process of making decisions that affect their lives and livelihoods and the benefits and services that they receive. something that keeps me motivated and something that I'm increasingly learning day by day is that proximity to the problem makes a huge difference in understanding that problem. And that's a big reason why community members are the key to good design and the key to effective programs. And so I think acknowledging that those end users, those community members with close proximity to the problem can be advocates and champions for change is crucial. And that's central to the mission of NFI and to the movement that we're creating on the Innovators team as well. It's a challenge. Finding space and yielding space to these communities and creating an environment that is safe and comfortable for them to vocalize their concerns and constructively engage. But that's a challenge that I am committed to addressing through our work at NFI and in our social protection program at GAIN. And I'm very excited to see already early signals of success and in helping to champion for inclusive innovations through this platform and through our co-innovation approach.
That's amazing, Anthony. And I actually saw a LinkedIn account, called Nutrition Futures Initiative. That's your account?
Yes, absolutely. The Nutrition Futures Initiative does have an account on LinkedIn, but that's not the only way that you and the listeners here can engage. To learn more about this initiative, I invite you all to go to nutritionfutures.org to read up about the initiative and to join this work. There's space for everyone, NFI, and all views are welcomed. And I'd also implore you all to visit innovators.team and to join our growing movement of innovators from across the global south that are working on social protection, but also so many other interesting and worthwhile innovation topics.
Yeah, join the movement. You heard it from Anthony himself. So I actually wanted you to tell people to join the movement and tell them how they can plug in, and you've done that. So thank you very much, Anthony. And Commissioner, when you think about the future of nutrition in Uganda, what gives you hope?
One, I think first it all begins with myself because I'm a very optimistic fella, and I always believe because of partly my experience and practice in the innovation and intellectual property management space, I always believe that radical solutions may not be the ones that have more impact. It could be incremental solutions, because the incremental ones just make you walk the journey with someone step by step and say, oh, there's something here, there's a change here. Now I think, and this incremental change could actually be just even starting from the point of you convincing the government just to tweak the policy a little bit in the favor of what actually the need at hand is. So again, also at the center of it all, I just strongly believe that we as Ministry of Trade, Industry and Cooperatives, because to me really when I talk about nutrition, I also look at it from the point of trade. Looking at industrial growth and the cooperative movement, because if you're going to talk about food security, you talk about also production, you talk about productivity, you talk about value addition and sustainability of food systems. So to me, I believe also the aspect of getting the right standards in place, implementing the right standards to ensure that food safety, and again also the nutrition that has to be defined across the different demographics. So I think it's something that is really going to be quite helpful. But again, at the center of it all, colleagues, I think partnership is going to be one of the most iconic kind of drivers of this to actually be achieved in the short, mid and long term. Because one, we could be having, and say the whole beauty of having co-innovation. With co-innovation, it also brings the different minds together, because I could be having the bright idea, but Anthony has the money. Thomas could be having the ability to scale this solution to another level. So meaning at the end of the day, this idea is for everyone. Everyone has a role to play. It works as a value chain where I don't need to do everything. Let me do my part pretty well. Someone is going to add up, another person is going to add up, another one is going to add up. And usually co-innovation will always, ideally, even in the nutritional space, it will generate brilliant ideas that people had never thought about before. Maybe as I conclude, this may be a little bit off topic, but let me give it as a case study of course, maybe for Mark, what I was trying to say is that if you look at in the space of drug discovery, the equivalent of where co-innovation comes to play is actually when clinical trials are being done. When clinical trials are being done, it's actually a way of co-innovation indirectly, because if I gave you a case study of one of the first drugs that became a blockbuster drug. Normally in drug discovery, a blockbuster drug is one that can actually fetch about $5 billion annual sales. And that was one of the famous drugs to do that was actually Viagra. Yeah. So, or it's called Cialis. So ideally, when it was being developed, Pfizer, the owners of that drug, their intention was never at all to develop an erectile dysfunction, kind of like a drug. No, that wasn't their motive. But not until when actually they started giving this to population to try it out, they're trying to check feedback and whatever. Then eventually they realized actually the feedback they were getting, some of those guys who participated in the trial were not willing to give back the remainder of the drug. They said, this thing, can you give us more? So when they had to really go back to the drawing board and say, what exactly is it? That's when these guys were not rigid in the approach they were taking. Because of the feedback they got from the people who participated in these trials, they changed the shift. And so behold, the famous drug came into existence. So at times, it's just a matter of just listening. As an innovator, you be humble, you listen. You never know. There could be helping you to save millions, billions of money that should have gone into research that will never yield fruit. Just by listening that actually this does this, and you go back to the drawing board. That's the looping and feedback loop that Thomas was talking about in the human-centered design. You listen to the end user, the beneficiary, and that's what basically I'm looking at. So really, nutrition future in Uganda, it's bright, and especially, of course, getting closer to work with Anthony and team, Thomas and team. I think this is something that can actually help us even to bridge the gap between academia and industry, to really work together and get solutions that can actually be scaled on that kind of platform to take them to another level. I look forward for more engagement and strategic alignments. Thank you so much, Mark.
Yeah, thank you, Commissioner, for those remarks. And you've just welcomed Anthony and Thomas. And, Commissioner, I do enjoy a cup of tea and some groundnuts. And I also know the way to Uganda. I'm your native. So, Commissioner, don't forget.
I shouldn't forget the moderate.
Very well. Well, ladies and gentlemen, what a wonderful conversation we've had. Today we have explored why co-innovation matters, how governments can embrace it, how social protection can deliver stronger nutrition outcomes, and how Nutrition Futures Initiative is actually helping countries build systems that are more human-centered, more adaptive, and more impactful. I want to say a special thank you to Dr. Anthony. I want to say a special thank you to Thomas, and also a special thanks to Commissioner Mugisha for being with us on By the Talk. Thank you for your leadership and your insights and your partnership, as you have reiterated. And to our listeners, thank you for joining us. We'll see you on the next episode of By the Talk.
Thanks for listening. Stay safe and eat healthy.